Welcome back to another edition of the Hart2Heart Podcast. And today's podcast is going to be on supplements. And I'm mostly going to be talking about my personal supplement stack. So I take supplements in the morning time. I also take them in the afternoon. Then I have a pre-workout supplement stack. And then I have a bedtime supplement stack. So there's 4 different times. I'm going to go through each one. And I'm going to go through each supplement and tell you why I take each one. So I know that a lot of people out there are very interested in supplements, and certainly there are many that are fantastic. There are others, though, that, just really don't do so much. And so I'm going to tell you again, the reasons why I take the ones that I do. So let's get into it. So let's first start off with my morning stack. So one thing that I start off with every single morning is 15 milligrams of saffron. So saffron's gotten a lot of attention lately over the past few years. I first learned about it from examine.com. They were talking about how it's great for various different mood disorders, whether it's ADHD, anxiety, depression. It seems like it kind of helps with everything. But one thing that I think gets really, really overlooked is how good it can be for memory. And so that's why it really caught my attention. And there was one study that came out, it was actually in 2010, and it actually showed that saffron was as good as a popular drug called Aricept for Alzheimer's disease. So what they did is they did a double-blind placebo-controlled trial, gave people saffron or they gave people Aricept, also known as Donepezil. And what they found is that the people who took saffron did just as well and had just as much of an improvement in mild cognitive impairment as people who took Donepezil or Aricept. So to me, that's just, an incredible study. And it also, to back up a little bit further, the mechanism of action there works as well. So the active ingredient in saffron is crocin. It's an antioxidant. It actually does pass the blood-brain barrier. So this makes perfect sense. So for me, that was really the thing that drove it home for me that, let's get started on this because, if it can improve patients who have already mild cognitive impairment or Alzheimer's disease, then, what could it be doing for people who are healthy? Now, I'm not saying that if you are healthy, it's certainly going to improve your memory further, but the reason I take it is to prevent any degradation in my memory. So I think that, by using it early on, I am going to offset my risk of getting Alzheimer's disease or cognitive impairment. So, incredible supplement that, again, I take, and I do take that again in the afternoon, which I'll mention a little bit further. But as I mentioned, though, too, you can also be good for various different health disorders. So it's associated with increasing serotonin and dopamine, and then also BDNF, which is brain-derived naturopathic factor, and that can be fantastic for improving overall memory. So incredible supplement, a lot of science behind it. And one thing that I've been talking about for a long time that I highly recommend to a lot of people for, again, all the different reasons that I just mentioned. Number 2 on the list in the morning is going to be alcar. So acetyl-L-carnitine. I usually take about 500 milligrams. And the reason I do this is basically twofold. So it has been shown anyway in rat studies that it can increase overall androgen receptor density. So for anyone who is trying to look to optimize their hormones or try to make sure that they get the most out of their testosterone, then you are going to want androgen receptor density or sensitivity. So, some people can have testosterone, flowing through their body, even high free testosterone, but when it gets attached to those androgen receptors, it's still not doing its job. And so by increasing the sensitivity of your androgen receptors, you can actually get more out of your testosterone. So that's an incredible benefit that alcar has. Also, though, too, it is, in fact, really good for your overall mitochondria. So mitochondria, as you may or may not know, is the kind of the powerhouse of your cells. It's really good for your overall energy and generating ATP. That's where we generate our ATP. So by using acetyl-L-carnitine, we can improve our overall mitochondrial health. And this may be very beneficial for our overall brain function, our mood, and just overall cognitive support. And so by using that supplement, you are in fact supporting your mitochondria, and something that I think is incredibly beneficial. And that's actually one of the only other supplements, again, that I take later on in the afternoon, which I'll discuss in a moment. Number 3 on the list is something called nattokinase. And I've posted about nattokinase before. So nattokinase to me is just, there was one study, I'll talk about it in a moment, that just like blew my mind. And that's really what, got me into taking nattokinase. And I do take a very high dose of this. So I take 12,000 FU per day. I know, very, very odd unit of measurement, but that is what it is, FU. So 12,000 FU per day. And I'll talk about the reason why I take that. So there was a study that they did, I think it was in 2021 or 2022, with over 1,000 participants. And what they found is that people who were taking 10,800 FU per day actually had a reduction or a reverse in their overall arterial plaque. And so, just incredible, because as we know, it's very difficult to reverse arterial plaque. It was shown in this study, and it was shown to reduce it by 36.6% over 12 months. And the next 2 on the list, which I'll come back to nattokinase in a sec, are going to be ASA 81 milligrams and vitamin K2. Now, the reason why I mention them with the nattokinase is because in that particular study that I'm talking about, it was those 3 agents all together. So the nattokinase, the ASA 81 milligrams or aspirin 81 milligrams, and the vitamin K2, where the participants got the most benefit or had the most regression in the overall arterial plaque. So, by using this supplement, you may in fact be able to reduce your risk of arteriosclerosis or heart disease, and then thereby, reduce the risk of having a heart attack or a stroke. So again, incredible, study. And the way that it works is that it's a fibrinolytic. So it breaks up the fibrin, and so it prevents clots from forming. And it's going to clear those fibrin and clear up microclots. So, again, by using that with ASA or aspirin, low-dose aspirin, and vitamin K2, you can get a tremendous benefit there. There is some, benefit as well in terms of it can potentially reduce blood pressure and reduce or improve your overall lipid profile. But again, those things are a little bit secondary on the list to me. The reason why, again, I'm taking it is because of that 36.6 reduction in arterial plaque over 12 months. And again, the dose I take is 12,000 FU per day. The reason why I don't take 10,800 that was done in the study was just because of the supplement that I have. It's in 6,000 FUs. And so I just take 2 of them, which adds up to 12,000, which is, just gives me a little bit of a buffer zone over the 10,800. But if you want to take 10,800 and take the dose that was used in the study, that is the dose that was used. So next on the list, like I said, is going to be aspirin, or 81 milligrams of aspirin in particular. So low dose aspirin, or a baby aspirin, as many people call it. And so this can reduce COX-1, which reduces thromboxane A2, which will prevent platelet aggregation. And so that's why it's synergistic with nattokinase. So it just adds kind of another layer of cardiovascular protection. Number 3 on the list is going to be vitamin K2. And so vitamin K2 you may have heard of before because it's often taken with vitamin D. And so because vitamin K2 has this incredible benefit of directing calcium away from our arteries and into our bones, that's why many people believe that it's so beneficial overall for our cardiovascular health. And so by taking vitamin K2, especially with the nattokinase and the ASA 81 milligrams, you are going to be putting yourself in a really strong cardiovascular position for reducing overall cardiovascular stroke and cardiovascular diseases such as arteriosclerosis, and reducing your risk of a myocardial infarction or a heart attack. And so again, what K2 does is that it directs calcium away from your arteries and into your bones. So you kind of get a little bit of a 2-for-1 there, because the K2 is actually going to be helping with your bone health in addition to helping with your overall cardiovascular health. So, a couple important points to note on that, though, is that, saffron and alcar, they can be taken with or without food. The nattokinase absolutely has to be taken on an empty stomach early in the morning. The ASA 81 milligrams, most people do opt to take that with food as well, but not necessarily do you have to. But many people find that if they do take it on an empty stomach, it can upset their stomach. I don't really get that particular reaction to it. The K2, again, that usually is taken with a little bit of fat. So, you can take it with your fish oil, olive oil, or whatever kind of oil that you may be using. And that can help with the overall absorption. So it's vitamins A, D, E, and K that are fat-soluble vitamins. And so whenever you're taking any of those vitamins, you do want to take them with a little bit of food. Another one that I do take in the morning is spermidine. I know, very strange name. I'm going to be taking about 10 milligrams of spermidine. And sorry, just to backtrack on the vitamin K2, I didn't mention how much I take. So I take 200 micrograms. And in that particular study I was talking about, they used a 180 micrograms. So I take 200 just because, again, in my supplement, it comes in 100 micrograms. So I just take 2 of them and top off at 200 instead of 180. But if you really want to be specific and go with what's in the study, go and try and source out 180 micrograms if you can. So just coming back to the spermidine and why I would take that. So that activates autophagy genes. So you may have heard of autophagy before. So autophagy is clearing the dysregulated organelles in our cells. So like dysfunctional organelles such as mitochondria, and that has been related to aging. And so that's the main reason why I take the spermidine, is more or less for like an anti-aging effect overall. And like I talked about in previous podcasts, autophagy is a major way of increasing your overall anti-aging effect. And so the dose that I take is about 10 milligrams. And again, this has been linked to mitochondrial turnover or clearing out our dysfunctional mitochondria. And it helps with immune regulation, and it has been shown to expand lifespan in certain model organisms. So a great thing to take. And also, too, one note on spermidine, it is a fairly inexpensive supplement, which is always nice, because I know that this list can get a little bit expensive as we keep going through it. Number 7 on the list is beta-alanine. So beta-alanine, the reason why I take that in the morning, and I'll talk about this a little bit later because I also take that as my pre-workout stack, is that it increases muscle carnosine. So that's going to buffer the hydrogen ions, and it's going to delay fatigue. So basically, when you get that lactic acid burn up, it's going to help delay that lactic acid burn up. And some people are maybe thinking, why are you taking it in the morning? Why don't you just take it pre-workout? Well, you actually want to build up as much beta-alanine as you can. So, it's not necessarily like a pre-workout supplement per se. It's more or less about like your carnosine stores that you're building up. And so if you can just use a little bit of beta-alanine throughout the day, then you can build up your carnosine stores much better. And that's what's going to really help you delay that fatigue and delay the overall lactic acid and kind of buffer out that effect. And so, like I said, a lot of people also with this find that it's very, very difficult to take a lot at once because they get these sort of paresthesias or tingling sensation that can make people feel very uncomfortable. I'm also one of those people. So I take 1.6 or 1.8 grams of beta-alanine, and I'll do that a couple times a day. You can actually increase that to 3 to 4 times a day if you want to, and you will get a better overall effect with that. But again, it's not necessarily like a pre-workout that you would take before. It's something that you want to take throughout the day so that you build up those carnosine stores. So let's kind of move on to the afternoon supplements that I take. So one thing that I take in the afternoon is going to be zinc. So the zinc supplement that I take has 20 milligrams of zinc methionine, 15 milligrams of zinc glycinate. And then I also should mention it has 3 milligrams of copper biglycinate. So the reason why I throw the copper in there or have a supplement that contains zinc and copper is because if you take too much zinc, then it can throw off the zinc copper balance. So you do want to make sure that if you are supplementing with zinc, that you're also supplementing with copper. So zinc supports testosterone, it supports immunity, it supports DNA repair. It's a fantastic supplement for all those things. And again, the reason why I take, the methionine and I take the glycinate, even though it comes in the same pill, is because you do want to make sure that you're getting really good absorption overall. And again, with zinc, you do want to take it with a little bit of food, because taking it with food is going to increase the absorption effect. And the other thing that many people are unaware of with regards to zinc is that, just coming back to the copper, is that the copper balances the zinc to protect mitochondrial enzymes like cytochrome C oxidase. And, that's the main enzyme that you're actually trying to activate or generate when you're using red light therapy. And so you do want to, again, really make sure that you do have a good balance there, because if you don't, you can really throw things off. Let's move on to another afternoon supplement that I'm taking, and this would be boron. And again, boron is something that I take also for testosterone. So it reduces the SHBG, which can increase bioavailable testosterone. So as you may or may not know, your SHBG is something that can bind to testosterone. And so that's why some people have high total testosterone, but then low free testosterone, because they have high SHBG. When you take boron, you can actually free up that testosterone from the SHBG that it's bound to and increase your overall free testosterone. And this has actually been shown in human studies. So, and it's also a very cheap supplement. So I'm taking about 9 milligrams of that per day. And I also, again, take that with food. And this may act also a little bit as an anti-inflammatory. So it has been shown in studies to actually reduce CRP, so C-reactive protein. Many people with actually like arthritic conditions find it to be effective for reducing overall pain. And it actually can help with bone building as well. So various different reasons to take boron. And like I said, very, very cheap supplement as well. Now, moving on to some more supplements that I take in the afternoon. So another one that I'm going to be taking for my mitochondria is going to be called urolithin A. So this is something that I only just started taking maybe in the past 3 to 4 months. When I had Dr. Casey Means on the podcast, she actually introduced me to that supplement, and she indicated that it can be great for stimulating mitophagy or stimulating the increase of removing old damaged mitochondria and then allowing new ones to generate. So basically, the reason why you want to take this is for your overall mitochondrial health, which can increase overall endurance and also just to help with your general fatigue levels and general energy. And so this one has become, I found a lot more popular online over the last few months. Maybe it's because of Dr. Casey Means, maybe it's for other reasons, because of new research that have came out. I think Dr. Huberman talked about it on a recent podcast as well. But it seems to be like this is one of the keys to mitochondrial health. And we also have, chat a lot about on this podcast, on other podcasts, about how mitochondria are just incredible for your overall mood and for overall cognition in general. And so anything that you can do to increase your mitochondrial health is something that you want to optimize. So sticking with mitochondrial health and the other supplements that I take in the afternoon, I'm going to go with PQQ. So this is something that I take in conjunction with CoQ10. So PQQ, I take 20 milligrams of that, and that's going to trigger mitochondrial biogenesis. So that's the making of new mitochondria. So, I've done podcasts in the past on how zone 2 cardio or doing cardio at 60 to 70% of your heart rate max can be effective for boosting or increasing new mitochondria. So can taking PQQ. And it also protects your neurons as well, especially when you're taking it with CoQ10. So, a very good supplement to add in if you're looking to increase your overall mitochondrial health. CoQ10, like I said, is the next one on the list, and that's going to power up your ATP production, particularly in your heart and in your brain. And this is really important too for a lot of people who are taking certain drugs. So there's a lot of people who are taking cholesterol lowering drugs, especially ones like, statins or bempedoic acid or ezetrol. these drugs have become, increasingly prescribed and more popular, over the last, 10 to 20 years, maybe even longer. And these drugs, unfortunately, while they can, increase or decrease your cholesterol. And again, I'm not really talking about cholesterol today and, the effects that has on the body. I have, a very kind of neutral opinion on that overall, meaning that, I really think that your LDL should be in the middle, like kind of like 3.5-ish. That seems to be the sweet spot in terms of, reducing your risk of cardiovascular disease while also maintaining a good level where it's going to not increase your mortality rate. But again, I'm not doing a podcast on that today. But for those people who are taking those lipid lowering or cholesterol lowering drugs, those drugs can actually lower CoQ10. And so by supplementing with CoQ10, you can get tremendous benefit. And so if you are on a statin or any lipid lowering drugs, I strongly urge you to take CoQ10. But like I said, it does work synergistically with all these mitochondrial supplements that I'm taking to help overall with mitochondrial health. So moving on to a few different vitamins that I'm taking as well. So vitamin D, I've talked about this, I don't know how many times on the podcast and how many, posts I've done, but incredible, obviously, for your immune system overall. We know that, people who had higher levels of vitamin D did better with COVID. They get sick less often, and they often get less severe disease when they do get sick. It's also really important for your hormone balance. If you have low vitamin D, you can have low testosterone, which we all know, again, is really important for your mood. And also, obviously, it helps with calcium regulation. And so making sure that you get enough vitamin D is going to prevent things like osteoporosis. But like I said, if you have low vitamin D, it can improve your mood. And if you have low vitamin D, you start taking it, and it can also increase your testosterone levels. So, by using that with vitamin K2, that's an incredible combination for your bones overall. So let's move on now to what I take for my pre-workout. And so for pre-workout, there's 4 different supplements that I take. So one of them you probably heard of before. Many of you are probably taking it. It's creatine. So, don't get any of the expensive creatines out there. You just need creatine monohydrate. That's the best one with the most research. You don't need to get into Purple K or any of these other ones that say that they're doing something special. So creatine is going to support the phosphocreatine system, and it's basically going to regenerate ATP so you can have more energy. But it also can be really effective for your brain health overall. So a lot of people now are using this as a nootropic. So they find that high doses of creatine, like I think Dr. Rhonda Patrick posted that like 30 grams of creatine is really helpful in severe sleep deprivation. I've seen other people, like even residents, talk about how they've taken it when they're doing these 24-hour shifts, and they experience just less burnout and have more energy overall. And so, not only can creatine be good for our muscles, it can also be just as good for our brains. So I actually think that it's just as effective for seniors as it is for bodybuilders. So again, something that I really think many people should be including overall in their supplement regimen, and it's probably maybe even close to the number one supplement that I would be recommending right now. Maybe that one or vitamin D. I'd have to kind of think about it. So I take 10 grams of that pre-workout. What else do I take? Number 2 on the list is going to be L-citrulline. So I take 10 grams of L-citrulline. So this converts to arginine, which is going to increase nitrous oxide production. So nitrous oxide production is going to cause vasodilation. That's going to increase blood flow. It's going to give us more vascularity, and it's going to give us that pump in the gym. So it really makes your muscles kind of feel good when you're working out, when you have that nitrous oxide production going and you really get that pump going. It can also actually improve endurance. So not only is it good for bodybuilding or improving your overall physique or improving the blood flow and when you're working out with weights, it can actually also be very good for when you're doing cardiovascular training or endurance. So an incredible supplement to take for, again, various different reasons. The third one I've talked about a little bit before, so that's the Beta-Alanine. Again, I just kind of throw it in with my pre-workout because it's just another time that I can take it during the day. I chatted earlier about how, it does need to be split up, because by splitting up the dose, you are going to get more of that carnosine overall, and you're looking for an improved level of carnosine. And that's what's really going to buffer out the lactic acid and allow you to do more work when you're doing that high intensity interval training. So again, beta-alanine is something that needs to be split up. Fourth on the list is just something that I've added recently. I don't know if I'm going to keep it here or not. So it's HMB, which is a metabolite of leucine. So you've probably heard of BCAAs before. It's branched chain amino acids. And the most potent out of those branched chain amino acids is leucine. So leucine is really good for muscle sparing. And so what HMB is the byproduct of leucine. So it prevents muscle breakdown. And it's really good when you're, fasted, or if you're doing some kind of like cutting phase. Sometimes for myself, I am a little bit fasted when I'm working out. And so by using the HMB during that time, I am going to possibly prevent some muscle loss. Again, it's not something that I've used for a long time, but it is something I'm experiencing with now. I can't say that I've seen a dramatic improvement overall, but I think I'm going to keep it now just because the research on it is so strong. All right, so let's move on to the last part of my stack. And this is maybe the one that people may be the most interested in, and it's my nighttime stack. So nothing too crazy for my nighttime stack, and you may have heard of this stack before. Most of it has been popularized by Dr. Andrew Huberman, but let's get on with it. So number one is going to be magnesium glycinate. I take 400 milligrams of that a day. So that's going to support muscle relaxation and GABA production. So GABA production is really important when you want to relax and when you want to go to sleep. And that can really help just set a little bit of a calm tone for the night. And many people have found that by using magnesium, they do get a better night's rest overall. The second thing in my list is also another form of magnesium, however. So this is magnesium L-threonate. I use about 2,000 milligrams of this. And again, this is what the things that Dr. Andrew Huberman has popularized in his sleep stack. And the reason why I take this at night is because it crosses the blood-brain barrier. So it's the only form of magnesium that crosses the blood-brain barrier. And it has been shown to enhance cognitive function and improve memory. So, by using both of those different forms of magnesium, I really think you're getting benefits from both, and benefits that can tremendously help you have a better night's sleep overall. The third thing on my list, and this is the one that I find actually probably to be the most potent or the most sedating overall, and I use a higher dose than what Dr. Andrew Huberman recommends, is apigenin. So I use 150 milligrams of apigenin. So apigenin is the active ingredient in chamomile tea, but it's usually only about 1 or 2% of chamomile is apigenin. And so you're really not getting that much apigenin when you're drinking chamomile tea. And so the apigenin is a potent GABA agonist. So it's going to help lower cortisol and potentially support deep sleep. So get you in a more of a deep sleep. So for people who are wearing Oura rings or various different trackers, you may find that when you're using apigenin, you actually get more deep sleep overall, which is incredible because, as we know, deep sleep is the restorative part of our sleep that we really need, that makes us feel rejuvenated and that makes us feel refreshed in the morning. One other thing about apigenin too that's kind of interesting is that it does have this mild aromatase effect where it inhibits aromatase. So that can potentially decrease your overall estrogen and potentially increase your testosterone level. So kind of a little bit of a 2-for-1 there that you get with the apigenin. So you get better sleep and potentially better overall hormone production. Lastly on my list in the nighttime stack and overall in my stack is going to be fish oil. So fish oil, I take 5 grams of that a day or at night, and 2 of it is going to be EPA and 1 of it is going to be DHA. And so, just really simply, EPA is going to be good for your overall cardiovascular health. It lowers triglycerides significantly. And then DHA is going to be good for your brain health. And so just coming back to the triglyceride part, a lot of people now are saying that the HDL to triglyceride ratio, or the triglyceride to HDL ratio, is actually more important than, say, LDL or ApoB and some of these other markers that people have discussed in the past. And so by using fish oil, you can dramatically reduce your overall triglyceride level. And so really important supplement for doing that. And the key to there is taking EPA. That's the dose that's really that's the part of the fish oil that's really gonna be helpful for doing that. And using about 2 grams a day seems to be really potent at doing that. And then, like I said, the other part is the DHA. That's good for your brain. I obviously recommend that to many of my patients who are pregnant because it's good for the mom's health. So it's also good for the baby's brain health. So an excellent supplement for overall brain health. But the other interesting part about that and why I take it at night is it can potentially increase your REM sleep. So I talked earlier about how apigenin can increase deep sleep, but by taking DHEA, you may increase your REM sleep. So your REM sleep, that's what's really important for your overall cognition. It's almost like therapy for your brain when you're asleep. You wake up and you feel a little bit better. Part of that is because of the REM sleep that you're getting, and DHA may be helpful for that. So guys, there it is. That is my whole supplement list. If there's anything there that you guys, want to ask me questions about, please leave them in the comments. I'd be happy to respond. And if there's anything that you guys think, I got wrong here, please leave those in the comments too, because I'd love to hear that. And if there's anything that you feel that you're taking that you feel that I should be taking, I'd love to hear more about that. Supplements are something that gets talked about all the time. But again, there's some great supplements out there, but there's always some really weak supplements out there as well. And so you do want to make sure that you are taking the best science-backed ones. And just one more note overall, because I did do a video on this earlier this week. So I don't purchase my supplements from Amazon. I have before, I have for years. I can't tell you for sure, whether I got burned or not, but, many people have been reporting that a lot of the supplements on Amazon are fake. And when you're looking at things like fish oil, you actually want those to be stored very, very properly. And if you're going to be ordering fish oil, especially during the summer months, you don't know if it's going to be spoiled before it gets to your home. And so for myself, what I do is I just order straight from the manufacturer. And by ordering straight from the manufacturer, you're much more likely to be getting a supplement that is real, and a supplement that also has been stored properly. And you do want to make sure that your supplements are third-party certified. So that means that someone else, another lab, has looked at the supplements and has said that, yes, what is contained within this supplement is what is in the supplement. And that should be, that should kind of satisfy overall what you're looking for in a supplement. So guys, thanks so much again for watching this podcast. I really do appreciate it. And as always, I'll be back with another episode soon.